We're going to Namaste and welcome to our CeRIMed Talk. Please settle down. We'll start within a minute or so to this very special talk. Thank you for all your participations and in the WhatsApp group, and saw a lot of interest coming up over the last few days. So today's program will be talking about the CeRIMed first, little bit. What is CeRIMed? Many of you may not be aware. And along with IWSP, which we do this kind of talk, very different kind of talk than what you hear otherwise. And that is supported by Reach Healthcare. And after this background, I'll talk about our speaker, and then I'll hand over this presentation. Then that is Shruti Sridhar is our one of the very prolific speaker in this kind of event with CeRIMed. Then we'll start. So this is, as you settle down, I'll just try to see things. Almost 40 people already joined, so we'll start another minute. And end of the talk, there will be a Q&A session, so don't. You can use the chat box for typing your query while the talk is going on. And request all of you to mute your microphone so that should not disturb the presentation time. Okay, so namaste and welcome to our CeRIMed Talk, which is one of the unique events we do almost every month, along with another event called IWSP, Integrated Wellness, Science and Practice, and this is supported by Reach Healthcare Services. Briefly speaking, CeRIMed is just born last year. It's mainly Center for Research in Integrated Medicine, where we try to connect not only regular allopathic or regular Ayurvedic things, but we try to promote integrated approach of treatment of any kind of health related issues. And we try to collect a lot of data, and also intend to do research in that line. So CeRIMed.in is a few professionals started, but we have a panel of doctors who are helping us to venture into this area. And one of our very esteemed and active participants and speaker is Dr. Shruti Sridhar, who spoke on this forum many times, and we are very fortunate that she's going to talk on a very unique subject called magic healing with medical cannabis. So today's talk she'll be covering, and before that I will tell that we also have an interesting event coming up shortly, so don't leave after the Q&A sessions, and which is going to start on Integrated Wellness Science and Practice event on August 12th. So please stay tuned, and you will hear about that event also coming up. And this is done with the help of Reach Healthcare Service. That's the telemedicine and the remote healthcare platform we provide to anybody having a specific concern. Can reach out on this website www.reach.health and get connected to a specific doctor to get the advice and get treatment too. Because actually last year, even beginning of this year, many of the COVID patients got a lot of help to this our remote healthcare service. So this is our background, what we do, why you do, and specific coming back to today's topic. This is on magic healing with a medical cannabis, which is such an interesting topic, not because is something unique, but is such an old practice in India, but it became underground because it became illegal because of the international trend. You'll hear what is the current situation of it. Obviously, we'd like to know more about where you stand today. But as I see that it is such a unique combination of both benefits and the danger. It's like I'm thinking about like a fire. Fire, we can't live without it, but if you know how to use it, you should get all the benefits of survival. Possibly Dr. Shruti may talk about it, but briefly, I like to introduce Dr. Shruti first now. Dr. Shruti Sridhar is a general physician, has done her MBBS in India, and she is practicing integrated medicine. And she finished her medical school. After that, she got trained in various alternative allied medical therapies, including homeopathy. She commonly uses homeopathy, herbal medicine, acupressure, nutrition, lifestyle, and allopathy for healing. She is trained in medical cannabis and using it for treating a wide range of illness. She is also passionate health educator and given many corporate talks, also the talks like this kind of forum and many health topics. Her holistic view of health addressing mainly focus on the root cause of illness rather than giving the standard symptomatic relief. So with that interesting background, I now request Dr. Shruti start her presentation. Dr. Shruti, please.
Thank you so much for the lovely introduction, and good evening, everyone. And thank you so much for joining in. This is a very special talk to me because it's been very close to my heart. So hopefully, I will try to make this interesting. And yeah, all right. I'll just start my presentation. One second.
Yeah, it's coming up.
Yeah. All right. Right. Um, so I'm just quickly going to get to the topic because you have given a very good introduction anyway. Cannabis was something that I'm sure we all have heard of. A lot of you must have even tried it recreationally, either in college or later on. And though the drug is banned in India, a lot of people do get it. I got into medical cannabis for one of my patients. As said, I do integrative medicine. So I was trying to look for a certain treatment and I wasn't getting it in other therapies. So I thought, okay, why not look into medical cannabis? That's when I got in touch with Dr. Tahir, who is one of the most, I would say, he's the pioneer of medical cannabis in India, and he has brought a vast range of knowledge here. So I got the good opportunity to train with him, and since then I have been using it, and I have seen some wonderful results with it. And I have now slowly started also raising awareness on this, and this talk is mainly for raising awareness that it is not fire as he put it in the introduction. It's largely safe, but that's the thing, that doctors need to be consulted for getting treatment, right? So that is the background. Now, for those of you who don't know what cannabis is, it's known through various names locally in India. So one of the most common names is bhang, and it's used in special festivals like Holi, and it is called as the nectar of God. And it's basically a flowering plant which grows as a weed in tropical and subtropical regions, and it has got an intoxicating property to it. So that's how it started gaining the interest of the drug authorities and all of that. But if you see historically, even Ayurveda has been using cannabis and cannabinoid preparations from more than 4,000 years. Even certain civilizations like Chinese, the Egyptian civilization, they all have been using cannabis mainly for pain relief along with opium. So it has got its place in the medical system well established. But it's only recently that we have actually found out how cannabis works in our body. And this came much later, like somewhere in the 1980s, when it was actually the molecules were discovered and they figured out how it acts. And that's when the medical cannabis got streamlined in a much better way. Now, there are two main strains that we know. One is Cannabis sativa and Cannabis indica. Cannabis indica is the one which is largely grown in India. Apart from this, there are many other strains which are generated in greenhouses, and these are mainly done in countries where the entire growing process is legal and they are able to tinker with the strain of cannabis that they are growing. So like that, there are a lot of strains, but naturally, if you see, there are these main two strains that is there. Now, before going further, I have to talk something about the endocannabinoid system. It's a very big word. It's a new word I can understand, but without understanding this, we cannot understand how cannabis helps us and how it, has this immense health benefit, right? Now, just like we have the hormonal system, the endocrine system, we have the musculoskeletal system, we have the circulatory system. Like that, we have something called as an endocannabinoid system in our body. Now, the interesting part is this also was discovered in the 1980s. So a lot of information about this is not available in the medical textbooks. Like I never read about it when I was doing my medical education. I learned about it only recently, like, oh, there is an endocannabinoid system. So what does this system basically do? It is one of the most ancient systems that is there. That is it starts from the smallest vertebrate, even pre-vertebrate organisms, and it has evolutionarily been preserved, and even in the humans we have it. It's even there in plants, it's there in animals, and even in the earlier animal forms it was there. So this is something which is preserved through evolution. So it should have a major role to play. Otherwise, it would have kind of, got diminished through evolution, right? But nature decided to preserve this system. Now, this system is highly complex. We are still trying to understand the complexities of the system, and it is primarily responsible for maintaining balance. Okay, in a scientific term, it's called as homeostasis, where a body, so like us, for example, our body is, it reacts to external as well as internal stimuli. So how to maintain the balance in the presence of external as well as internal stimuli is called as homeostasis. So this system, the endocannabinoid system, it maintains this homeostasis despite the fluctuations. So it is highly, highly important that this system remains in order and doesn't get disturbed, because if this get disturbed, then our response to the external stimuli or internal stimuli gets disturbed, right? So obviously, this is a system which is made to fine tune all the other systems. We will see that in the coming slides, like which system it balances and how it balances. It's a very beautiful thing to see, actually. Yeah, so the endocannabinoid system is a cell signaling system. So without going into too much technical details, you have to just remember that this system is important to maintain our functions normally, okay, throughout our daily life. Now, how does this work, right? Just like we have neurotransmitters in our brain, what does a neurotransmitter do? It is released when a certain stimuli comes, and it goes and locks itself in a receptor. And once the lock is established, it triggers certain cascade of reactions, and further things follow. This is the same way how the endocannabinoid system works. So there is a receptor for the endocannabinoid system where the molecule comes and fits, and once the lock is established, further activity goes on. This is how simply it works. And the receptors that are mainly part of the ECS, they are called as CB1 and CB2 receptors, cannabinoid 1 and cannabinoid 2 receptors. There are many more actually in this, which is, they keep discovering it as the years go by. but I don't want to get into the complexity. So for now, we will just focus on CB1 and CB2 receptors. And the molecules which activate these receptors, they are called as endocannabinoids. Endo means something which is produced inside our body, and cannabinoids is a molecule which stimulates the endocannabinoid system. Now, what does this ECS actually regulate? Now, you can see that there is a host of things which the endocannabinoid system regulates, and most of these are very vital functions in our body. So, let's start with something as simple as sleep, right? So, once you wind down and you are going to bed, your endocannabinoid system kicks in and it calms your brain down. It gives you that blissful sleep, lovely dreams, and then you feel refreshed when you wake up in the morning. So, nighttime, the ECS takes over and it helps to maintain a good sleep. So, if your ECS is not functioning properly, if it is overstimulated or understimulated, you will end up having sleep disturbances. The next main thing that it stimulates is your appetite. So, it regulates how much hungry you feel, how much is your hunger, how much is your satisfaction, how much more food you need. And this, it depends on your, what signals it's getting from the body. So that's how it stimulates your appetite or decreases your appetite depending on that. The digestion, very, very important. Immunity. Now, immunity, it's very interesting to see how it works. So it doesn't directly increase your immunity, but what it does, it signals your immune system to function more or function less, which is very important. Because now I think in COVID you would have heard about this cytokine storm and the immune system going into overdrive. So all those aspects are controlled by the endocannabinoid system. So if the endocannabinoid system functions well, then your immune system will not go into overdrive and produce unnecessary symptoms, right? It will hold it back, and your immune response also will be less. Less as in it will be altered to the stimulus, right? It will not be hyper, which is happening in most of the health conditions. The next main thing is euphoria. Euphoria is something that is staying in a blissful state. And this was the reason a lot of the aghoris or the, the sadhus who follow Lord Shiva, they take cannabis to deepen their state of meditation or deepen their experience of nirvana, I would say. So, because euphoria is something which is altered by the cannabis. Neural protection, very, very important. So your each and every nerve cell in your body, in your brain as well as in your body, they have CB1 receptors, CB1 and CB2 receptors, and these receptors are protecting the nerve. They are protecting them from damage, oxidative stress. They are protecting them from overly firing. That is what is called as neuroplasticity. So overly tiring, it prevents that. So it has got multiple roles to play, especially in the brain. The next thing is neurogenesis, which is very, very exciting, because until very recently we thought that nerve cells cannot regenerate once they are destroyed, and science did prove it wrong, and it said that no, neurogenesis can happen. And later on they found out that certain molecules in cannabis help in neurogenesis as well. So a lot of conditions where there is damage to the brain, or there is you would say the nerve cells are getting lost or damaged, it can be regenerated using cannabis. Forgetting, this is actually very, very important, because we if you actually think about our experiences, we've had a lot of negative experiences in our life, but we get the will to move on because we forget those negative experiences. And if we don't, we end up getting anxiety, PTSD, or post traumatic stress disorder, depression, and all of that. So forgetting is actually one of the key roles that cannabis plays, and that is why it is used in wide range of mental illnesses as well. And lastly, learning. So learning is also something which uh, the ECS works on. So you can see the array of function that ECS does, and it regulates. So you can imagine how many issues it can treat, because it regulates so many things in our body. Now, I just now talked about endocannabinoids. So, endocannabinoids are those molecules which are produced in our body. So, there are two main endocannabinoid. One is 2-AG and AEA. AEA is also called as anandamide, and the core of this word is ananda or bliss. So that is why they called it bliss. They called it the bliss molecule. Now, these two molecules are secreted by our own body. So, when our nutritional status is optimal, our lifestyle is good, everything is good, we have optimal levels of 2-AG and AEA in our body, and hence our entire functioning is normal. So, we don't have disease or ill health. When it goes off, that is when we get disease or ill health. Now, the second type is that's called as phytocannabinoids. Phyto means plant-based. So, plant-based cannabinoids like that we get in cannabis, there are two main molecules. Actually, there are a lot many molecules, but let's just talk about two. That is the THC and the CBD, which is most commonly known. THC is tetrahydrocannabinol and CBD is cannabidiol. Okay, we will go into details in the further slides. And the last category is synthetic cannabinoids. So these are used in the medical field for various reasons. So it could be for pain relief, it could be used post-surgically. It was also used for, there was one which was used for weight reduction, but it had a lot of side effects, so it's no longer used. So these two are most commonly used. Even in India, a lot of the doctors are using it. But in today's talk, I want to focus on the natural phytocannabinoids, because we see a difference in the synthetic and the natural between these two on how they act, how is their safety profile, side effect profile, all of that is completely different, right? Now, this is very interesting. If you take this human body, you can see that CB1 receptors are green and CB2 receptors are blue. So literally almost the entire body, you can see the receptors, the brain, the spinal cord, the stomach, the intestines, the reproductive system, muscles. So all of your entire body, CB1 and CB2 receptors are scattered. All right. Now, somebody, you're going to ask me like, oh, so is it that only cannabis can stimulate the ECS? There's nothing else which can stimulate the ECS. This was a question which I had, and I also asked my sir this, like, oh, why is that only cannabis can stimulate ECS? But it's not the case. ECS can be stimulated in different ways. Now, the most important thing in food that you need to stimulate the endocannabinoid system is omega-3 fatty acids or arachidonic acid, because the molecules 2-AG and AEA, the base of those molecules are omega-3 fatty acids. So if your food has got enough fatty acid content, especially the omega-3s, you automatically have enough substrate to manufacture these molecules by yourself. So the list of food items, so these are basically rich in omega-3: hemp seeds, hemp oil, flax seeds, chia seeds, walnuts, sardines, eggs, omega-3 supplements you can take, cocoa powder. Echinacea is another herb. It's also homeopathic medicine and also herbal medicine, and is also a great anti-inflammatory and an antibiotic. And that also stimulates the endocannabinoid system. Turmeric, which is largely used in Indian cuisine, that also stimulates the ECS. Green tea and exercise, dancing, swimming, basically physical activity of any sort, and yoga, meditation as well. So basically, anything which can stimulate the production of the good hormones stimulates the ECS also, and the certain food products as well. So even without cannabis, you can use all these things to up your endocannabinoid system. But when do you need to use cannabis? Now, it sometimes happens that the ECS tone or the ECS functioning has become really, really low, that even by using these techniques, it's not able to come up. That is when you have to use external sources of cannabinoids, and cannabis is one of the best that you can get rather than the synthetic ones and the medications, because as I said, when you take a plant in its whole form, like cannabis is, we are, experiencing its entire healing property. There was a talk by Dr. Hegde. He said that if you take curcumin out of turmeric, haldi, you won't get the benefit of it as much as you would if you actually powder the entire haldi and you eat it. And that is very profound and that is true. Even Ayurvedic practitioners, I think, believe that, the entire plant is a lot more medicinal. And now we have understood how fine tuned even the entire plant is. There are various other components other than CBD and THC which come into play. So there are terpenes, there are polyphenols, a lot of other compounds, more than 100 active compounds which are found in cannabis, and they all work in synergy, and they create a much better healing outcome than these isolated molecules ever would. So, one of the main properties that cannabis is so famous for is inflammation, because it is a very, very potent anti inflammatory. Whether it be THC or CBD, both are highly anti inflammatory. So, what is inflammation? As I said, when your immune system goes into overdrive, it starts attacking the body's own cells, body's own tissues. That is where the ECS comes into picture and says, Baba, stop, you are killing your own cells, you're killing your own body. So when that system is lost, that signaling is lost, inflammation sets in, chronic inflammation sets in. So there are certain diseases that come, like for example, there is rheumatoid arthritis, multiple sclerosis, lupus, SLE. Most of these chronic autoimmune diseases, they all have a basis of inflammation. So they have chronic inflammation since many years, and that sets in a cycle of pain, discomfort, swelling, even organ destruction, which happens with arthritis. So cannabis is one of the most potent anti-inflammatory, and hence can be used very well for chronic pain. Even neuropathic pain, which is seen commonly in diabetics, uh, cannabis works really very well. Parkinson's, as I said, it directly acts on the brain because the CB1 receptors are present in the brain, and the under the effect of cannabis, the if it is used early on in the disease, especially, the tremors can be reversed, the degeneration, the neural degeneration can be reversed, and a lot of positive things can be seen, especially in Parkinson's and Alzheimer's. Chemotherapy induced nausea and vomiting. Now, this is the most common use of cannabis presently, even in the US, Canada, wherever the countries it's legally allowed. Since many years, it has been used for removing the side effects of chemotherapy. So, when you use cannabis along with chemotherapy, it reduces the nausea, vomiting, improves the appetite, even helps in weight gain in cancer patients. And there has been research over the last maybe 10 years on the effect of cannabis on tumors and cancers themselves. So that also has been very, very promising. Dr. Tahir has been doing extensive work with cancer patients, and he has some amazing results that we can see. Now, slowly, the studies are coming as more and more countries are legalizing it. UN has legalized it. A lot of studies are coming up regarding the effects of cannabis on cancer as well. Epilepsy, again, epilepsy is a condition where there is hyperstimulation of the nervous system, and cannabidiol, which is CBD, which is one of the what do you say? It is one of the potent depressors of the CNS. So it kind of literally calms you down, and it calms things down. So in epilepsy, it can be used as well. Inflammatory bowel disease. Inflammatory bowel disease, again, it's a condition where there is chronic inflammation sets in, which is set in your intestines, and it causes diarrhea, pain, cramping, and all of that. And cannabis or ECS directly contributes to stopping the diarrhea as well as reducing the inflammation, reducing the cramping, improving digestion. So has multiple effects, especially when it comes to IBS. Anorexia. So in anorexia, there is a lack, not just a lack of appetite, but there is also a mental condition that is associated along with the lack of appetite. So it helps in improving the appetite, stimulating the appetite, giving the sense of joy, euphoria, helps quite well in that as well. Diabetes. In diabetes, it has got a multifold approach. Firstly, it improves the inflammation in the pancreas, because one of the reasons for diabetes is autoimmune, especially the type 1 diabetes. It's autoimmune, where your body is destroying its own pancreas, and so the insulin is not produced and you are diabetic. So it helps firstly to reverse the inflammation. Secondly, it stimulates the insulin sensitivity in the muscles. So your insulin resistance goes down, and your fasting sugar and post meal, everything goes down. So in diabetes, it's helpful. And because it's helpful in maintaining the glucose control, it's also helpful in maintaining PCOS, because PCOS, the underlying error, metabolic error in PCOS is insulin resistance for most of them suffering. So once that gets corrected, slowly everything gets corrected. PTSD, I had just discussed about forgetting. So it blocks the negative memories. And this has been shown through studies. I mean, I was very amazed when I read this study where cannabis has actually, when they gave it and they checked, it actually reduced the remembrance of negative memories in those who were suffering from PTSD. It was an amazing study that was done. Anxiety, depression. I have not added depression in the list, but yes, depression as well. Bipolar disorder, schizophrenia. These are all certain mental health conditions where it can be used as well. Insomnia. So, like I said, sleep is one of the biggest things that the ECS regulates. So, insomnia can be due to various reasons, but definitely cannabis is something that one should try if they're suffering from chronic insomnia and nothing else has helped. Definitely, I think they should give this a try. Hypertension, the molecule THC has got a direct vasodilatory effect, as in it dilates the arteries, thereby reducing hypertension. So somebody who is having hypertension, if they are given certain formulations, it can quickly bring the blood pressure down as well. So atherosclerosis, again, it's a condition where your plaques are formed in the arteries, and then finally it causes heart attacks or brain strokes and all of that. And CBD can definitely help in slowing down the process as well as reversing the plaque formation. And AIDS, like in AIDS, there's a lot of weight loss, appetite, nausea, vomiting that happens. So definitely cannabis helps to increase the appetite, and it causes, actually studies have shown that it helps in weight gain in AIDS patients. So the use of cannabis is actually immense. Like I will tell you, the first patient I gave cannabis to, she is a 1.5-year-old girl, and she was born with a condition called as hypoxia. As in, when she was born, she did not cry immediately, so the brain did not receive oxygen immediately, and hence there was a lot of degeneration in her brain, and due to that, she did not develop after the age of 1 month. So when she came to me, she was roughly 1.5 years, and we decided to start her on CBD. As soon as I learned about it, I said, oh, no, I want to use CBD with her. And we have seen such amazing progress in the last 4 months that now she has started crawling or moving backwards. We have reached there in the last 4 months, which did not happen in the first 1.5 years. So I think when doctors learn about cannabis and ECS, the applications are immense, because once you understand the pathology, you understand the physiology, then you know where to apply it. So which is what I am doing with my patients. So there is no fixed list of symptoms or conditions where it can be used, but these are broadly the ones that definitely can be used, and there are studies that it also helps them in those conditions. Now let's come down to the part of it that everyone seems to be interested in. What are the adverse effects? What is going to happen? Now, the molecule that is THC, that is the molecule which causes the high, or that gives the euphoria, and that gives you that pleasure. So it can be stimulatory for a lot of people. and they might not be able to tolerate it. So once they take that, they feel very disturbed, or they might have a bad trip, as we call it, or they might get into severe anxiety, panic attack, and something like that. So, which is why when we assess a patient who is coming in for medical cannabis, we assess if they'll be able to tolerate the THC and how much they'll be able to tolerate. And there are different formulations that are available in the market where the ratio of CBD and THC is altered. So we have formulations with zero THC, very low THC, medium THC, and high THC. Now, the high THC formulations are still banned in India, like we get it in the US and Canada quite easily. So overdosing and adverse effects are seen there more because, they take the higher THC without knowing if they can tolerate it or not. But in India, with the formulations that are available, it's very, very rare that somebody would go into a really bad trip. And if there is a doctor who is with you, who is assessing your feedback, then definitely it's much safer. There are certain other side effects we see sometimes. There's constipation, slight dizziness, dryness of mouth. In some cases, there's even lack of pain relief. I will not lie to you. Of course, there are some cases where it doesn't work. That also happens. But most of these side effects, like constipation and dizziness, they are very transient. I mean, it would happen for maybe 1 week or 10 days, and your body gets accustomed to the molecule, and then most of the side effects, they just disappear. CBD, on the other hand, is largely safe. It can be very, very safely used even in children without any fear of being neuroexcitatory or stimulatory or anything of that sort. And other than these two, there are a lot of other molecules also, but they don't have any major side effect profile per se. So this is what is the this I'm talking about the medical cannabis. Now recreational cannabis is very, very different. Now recreational cannabis is directly where you take the leaf or the bud and you powder them, and then you roll it and you smoke it, or you make it into a brownie and eat it. That is recreational cannabis. In that, there is no way to control the CBD THC levels. THC is generally very, very high. So somebody who is listening this talk, if they have done cannabis in the past and they have not tolerated it well, that doesn't mean that medical cannabis will not suit you, because as I said, we give the formulation that suits that person. So we can give a formulation which has zero THC and just the other molecules. So, there is no fear of going back into the bad trip again. Yeah. And again, I'm sure everybody must be wondering about the legalities. Now, medical cannabis is largely legal in India. I'm saying largely legal because the growing is restricted to only government authorities. So the government provides the raw materials to the manufacturers, and the manufacturers have the license to produce cannabis infused medical products. And only registered medical practitioners, as of now, like general physicians and Ayurvedic practitioners, are allowed to prescribe. And the medications are to be given only on prescription. So it comes under Schedule H1, that is, it cannot be sold in retail without a prescription. So this kind of puts a onus of responsibility on the manufacturer, the retailer, as well as the doctor. So it's kind of dispersed, the responsibility is dispersed to all of them. So it's tightly regulated. So don't think that you're having something illegal or this is something from black market that we are providing to you. Absolutely not. And just to add, bhang, which is made from the leaves of cannabis, has always been legal in India. So in India, the leaves are legal. So anything you make from the leaves of cannabis is totally legal. What is banned is the flower and the bud and the resin. These are the three parts of the plant which is banned. And so all these manufacturers, they manufacture it from the leaves. So the raw material is sourced as leaves, and the extraction process is done, and that's bottled and packed and manufactured. So the entire process is completely in the legal purview. A lot of changes are coming in the cannabis laws. I am sure that maybe 1 year down the line, even the other things might be made legal, because UN has made it legal. A lot of countries have started making it legal, and there are a lot of players already that have come up in the market. There are various brands available. If you just search for medical cannabis, you will get like at least off the top of my head 7 or 8 brands that are currently manufacturing it. So yeah, so it's completely legal, and if you take it under the guidance of a medical doctor, then definitely it'll help you in whatever health problem that you're looking for. And if you want more information on this, I have created a knowledge website. That is, I've tried to put as much whatever we have discussed plus more. So I've put studies on the website. It's called as cannabisclinicindia.com. So I've put studies, I've put references, I've put certain descriptions of certain diseases, how cannabis can help, what you can do, common FAQs and all those things. You can go there and you can read more about it. And I would like to add here that because Reach and CeRIMed, it's very integrative in its platform, and they were very open to using medical cannabis for some of our patients as well through Reach. And I'm very thankful to Anirban, Naresh, for being so open, for letting me do this. And when I spoke to them, they said, "Oh, what is this? We have never heard of this." And I said, "Yeah, yeah." And I took the time to explain it, and they were also very happy to get me on board and even use it for some of our patients. So yeah, I think integration is the way forward from here. Yeah.
Okay, thank you, Dr. Shruti. I
Thank
think
you.
it's a very wonderful and unique presentations on a totally new subject where we look at and a lot of suspicion. That's
Yeah.
why some questions came
Sure.
before those thing. Actually, when you are out of disconnected, I was telling the audience that interestingly, when you Google even medical cannabis, you'll find one of the startup. I don't remember the name. Something called Hemp something. The based out of Bangalore is a Odisha-based company. They started their
Right.
startup company last year, as
Right.
was last year.
Yeah. Yeah.
So
Boheco.
possibly, and
Yeah.
they are addressing what you said, Schedule E1 and H1, using that
Mm-hmm.
options. All the legalities they're addressing. So there is a question on, is it legal using cannabis? Does it not attract NDPS Act?
No, it does not. As I said, the what we are using is medical cannabis. The raw material is legal. The licenses provided to the manufacturers are legal. The retailers are allowed to sell it. So the manufacturers only sell it. There are no retail stores per se. Directly, the manufacturers, they have somebody to do the distribution and they do the selling, and it directly goes to the patient's house. Like, even we don't stock it as doctors, we don't have anything over here. It's just between the manufacturer and the user. So it's kind of tightly regulated in that sense. So it's absolutely not illegal, and we will be providing a prescription each time. So it's my signature and stamp that goes on the prescription, saying that I have prescribed it for such and such case, for such and such issue, to such and such patient. So it's completely black and white over there.
Okay, I think it's very clear cut, at least on paper, and that's where uh, we have to see how it is picking up among the awareness. The awareness building was the
Yeah.
main purpose of this
Yeah.
seminar. Hopefully, people will be less skeptical when someone suggests this is a method of treatment. And there is another question telling that which is a better way to use cannabis, by smoking or by ingestion? Ingestion.
Actually, if you talk about bioavailability, that is, bioavailability is the percentage of molecules that you absorb. So, like every drug, even if you take something as simple as paracetamol, 100% of what you're taking is not what you absorb. There is a percentage, either 50% you absorb and 50% just goes waste. So the bioavailability is definitely more when you smoke cannabis compared to when you ingest it. There are different routes. There is transdermal, where you do skin application. There is even suppositories which can be given vaginally or rectally. So that bioavailability is different. Then there is oral route, there is through your nose, through your eyes. There are various ways that it is done. So depending on the discretion of the doctor, if he feels that, like for example, there was a case of cervical cancer. So for her, it is better to give it intravaginally rather than take it orally. So that is the what do you say, the decision of the doctor, how he or she decides to use it. But there are various ways, and each way has different bioavailability and different effects that we see.
Yeah, so that's a very, very detailed question. So at the same time, I like to remind all our participants, if you have a specific problem, you're looking for specific prescriptions, you can get in touch with Dr. Shruti through our rich healthcare services. And but there is a question also came that medical officers are aware of this emerging field, and how do you get prescription? What is the prescription for DM2?
So, medical doctors,
So
so like me, there are very few who are aware of this, and mostly it is a taboo subject even for doctors because I think they don't understand. Even when I, before I knew about medical cannabis, when I read about articles like, oh, this person's cancer went and this happened, that happened, even I used to feel this is all just anecdotal, stupid stuff, you know. But when I went into detail, I read the research papers, understood how it works on your system, then it was a totally different game changing view for me. So doctors are yet to be aware of it. There are very few doctors like me who are practicing it, but there are doctors, I am also aware of 5 6 of them who are doing medical cannabis and using it in their practice. Mostly oncologists are very much aware of it. Oncologists, they are basically treating cancer cases, and they are aware of it because abroad it is used very commonly in cancer patients. So most, in fact, a lot of oncologists come and tell me that, oh, we didn't know that this was legal and we could do this because we knew this was available, but we couldn't offer it to our patients because we didn't know that this was there. So they are in fact very positive when it comes to cannabis. Yeah.
Yeah, I have one specific question. Just wanted to check because it's an Ayurvedic system. Normally, Ayurvedic system, but the same symptoms depends on your prakriti, whether you're a
Hmm.
Vata,
Hmm.
Kapha,
Yes.
Pitta type,
Yes. 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 Right.
and you give a different kind of prescription. So, do you do same thing do with a cannabis?
So yes, definitely. And but if you see Vijaya, so cannabis in Ayurveda is known as Vijaya. So Vijaya has a property of balancing all the three doshas. It is
Hmm.
very unique that way. There are very few, plants which can do that. And Vijaya also potentiates the actions of other herbs. So when they use Vijaya infused Ayurvedic, there are certain products which has got Vijaya in it and other components in it. The other components also work better when it is added with the cannabis, you know. So that's how it works. So it works, it potentiates the other Ayurvedic herbs in it, as well as it is also medicinal in its own way. So that's how it works.
Okay.
Yeah.
Uh, Naresh, can you start taking up the rest of the question because I'm sitting in the dark. There is no current here.
oh,
But
no issues, sir.
Right.
No issues.
So there is one, somebody asked what is the prescription for diabetes. So the thing is, there is no fixed prescription for anybody. There are different formulations available depending on what is your general nature. So we also try to understand that what is your basic endocannabinoid tone. Are you deficient? Are you hyper? What are your other symptoms? What other issues you have? So using that as a clue, we kind of figure out that which formulation will work for you basically. But if you are even smoking just a joint or a cannabis, that will also help you definitely, but that is not legal in India, unfortunately. So we can't do that.
There's a question: can this be taken for wellness rather than cure for illness?
Yeah, I actually want to say yes, but I don't want to say yes because there will be a lot of wrong uses. But yes, cannabis can be used for wellness because even though we say we are well, so we need some balancing all the time. So definitely it can be used. Very low dosage needed, not a lot, but again, it has to be assessed if you'll be able to tolerate the THC, how much THC you'll be able to tolerate, and all of that is required. Yeah.
End of the day, it has to be prescribed by doctor and
Yes,
legally
yes.
used.
Even for wellness, if you need to take it, it has to be under prescription only.
Yeah,
Yeah,
because it's a legal requirement. So everyone need to go
yeah,
by that. They
yeah,
have no
yeah,
option. Yeah.
yeah, yeah.
So again, the same question comes: how can cannabis useful for diabetes?
Yeah, so that's the thing. So diabetes,
Yeah.
it helps if you just start it. I think you will know the difference, because I'll tell you one diabetic patient. I remember him because he came yesterday for a follow-up. For almost 2 years, he was with me. We were treating with homeopathy, but his sugar levels were never, his fasting was always above 200, always. And after starting cannabis for 3 months, he took that. Now his fasting is completely normal. His post meal is completely normal. His fasting is like 100. And I was shocked. I'm like, how is your fasting 100? He's like, I'm like, I don't know. Whatever you did has worked. So that is the thing we saw, because initially, even with the diet and the medicine and homeopathy, everything, his sugar would never come under control. But after this, when that's why I said, ECS regulates the other system. So it's like a master, you can say like a master there. So it puppets the other system. So it helps in the other system functioning in a better way.
Got it. One question, a specific question. I had a lipoma, and
Yeah.
in will
Yeah,
it help?
so lymphoma, definitely it will help in preventing recurrence. As I said, it modulates the immune system, so it will definitely help in modulating your immune response. In also the it modulates the white blood cell production, so which basically goes wrong in lymphoma. So that will also, it will help. And generally also, because ECS, or the endocannabinoid system, it has a big role to play in cell multiplication. That is why it is so helpful in cancer, all sorts of cancer, wherever, because cancer is basically cell multiplication gone wrong. That is what is cancer. So it helps in any form of curbing any form of excess multiplication, excess growth. It also promotes autophagy. Autophagy means it causes the cell death of the cancer cells on its own, because of the ECS, this thing. And it causes apoptosis, that is cell death. So because of these three things, reducing the growth, increasing autophagy, increasing apoptosis, it is so useful in cancer. So definitely in lymphoma also it will help. If you are in remission, you can definitely start it, because you might not be on chemotherapy. So the only thing is, if you're already on chemotherapy, you take cannabis, it helps, but the effect is a little suppressed because of the chemotherapy. But for some patients, they need to take it because they suffer from severe side effects of chemotherapy, and this cannabis helps them for that. So yeah, that is the thing.
Yeah. So another, I think somebody asked about Dr. Shruti's details on web link. You can please go to reach.health. You will see her profile, and we have given her, I mean, the helpline number. So through them, you can connect. Next question. I think this is a doctor's question. Do you need a certification to prescribe cannabis therapy?
And Dr. Pranav, I think, yeah. So
Yes.
Dr. Pranav, you don't need a certification for this. There is no certification per se. But I think it's just more of connecting with people who practice this and doing your own research as of now. Although there is an organization which is now coming up, is the Indian Academy of Cannabinoids, which is run by Dr. Tahir. He is going to start a certification, but again, that will be his own certification. I don't know if it will be affiliated with the medical bodies and all of that. So it's more of, I think, your own knowledge with coupled with your own research, and you talking to other practitioners about their experiences. As of now, this is where it is. Yeah.
I hope that it will get little more
Yeah, you
formal
can
in
get in
future.
touch with Dr. Syed Tahir. If you can, I'll write his name here in the window. So if you're interested, you can just email him. His details is available on Google. So you can email him, and if you're interested, he is going to start with a course soon, the second batch. So I was there in the first batch. He's going to start with the second batch. So you can definitely, get in touch with him.
Another question.
Where do we get cannabis based medicines in India? So there are a lot of companies that make. There is Indian, there's Total Heal, there is Cannabril or Indogenics, which is another company that makes it. There is I Love Hemp. I Love Hemp, that is one company. Then Noigra is another company that is making it. So basically, a lot of companies have now started manufacturing. There was just one. Vedi Herbals was the main company that was doing it. Now, in the last 1.5 years, it has sprouted like anything. There are like so many players in the market right now. but not all of them are good quality, which is where we come into the picture, where we try to see which works better and what is more quality controlled and what we can prescribe. Because in most of the preparations now, they put very little cannabis extract and lot of carrier oil. So the potency is not as much as we need for certain conditions like cancer. So yeah, so we give the formulation that will work best for the patient.
So I think somebody asked, informed about South Africa picture. Also wanted a WhatsApp number. The same helpline number has got a WhatsApp too. So through that you can connect. Can cannabis useful for ecophagus cancer cure?
Right, 1 second. So in South Africa, he said that it's available in retail stores without prescription. That is true. A lot of countries do it. So in Canada, US, Australia, and also South Africa, since you're saying, even in UK, it's available without prescription. But I always say that whenever you're taking it, at least get one consultation done with a doctor to figure out if this is the best suited for you, if you are not aware of the science behind it. Because I know a lot of people who are not doctors, but they have done more research in cannabis than I have. So if you are that kind of a person, then please go ahead. Absolutely no problem. Esophageal cancer, definitely. See, I cannot talk about cure because it is not legal to say that cancer can be cured. But as I said, cannabis has a very, very potent anti-cancer effects because it stops cell division, it induces cell death, and it also helps in modulating the immune system, which is what is responsible for the cancer as well. So a lot of ways it will help. It will help in pain management, it will help in symptomatic relief. If you've already taken chemotherapy, it will help with that. So definitely, I think you should try for it. If you are suffering and this is it, then you should try for it.
Yeah. Next is a logistic question. So you still can connect with WhatsApp number. We will find a way legally how it can be done. Regarding sending to South Africa, he's asking. I think that's all we have. Don't you want to talk about any? There is one more question.
There is one feedback form that please, whoever is there in the call, please fill in the feedback form, so it will help us understand what more you guys need.
Yeah. Thank you, Dr. Shruti, for your presentation.
Okay.
I'll just have a quick 2 minutes. Please stay on. We just need to talk about. So this talk is completed. We just as a platform from IWSP CeRIMed, we do have a lot of programs. We just want to give you a brief about this program. This is a program called Integrated Wellness Science and Practice. This is called Holistic Wellness. Transform lifestyle to revitalize and regenerate. I think we have sent this brochures across in our WhatsApp group, and we will send it one more time. This is a program run by two eminent doctors. One of them is in the call as well. So Dr. Sushil Sharma, who is an interventional cardiologist from US, as well as Dr. Shivkumar, who is a diabetologist he is also yoga guru. So this program is mainly on lifestyle disorders and how do we handle it. This is a 12-week program, 3 days a week, and morning and evening it repeats, 6 to 7:30 live on Zoom. So it's going to be on your home. You can attend this program. So we have done about 4 batches, and this is the 5th batch we are doing it. Almost 200 people, 200 plus people got benefited, and they are there with us and to do this program. We do have on 12th of August, we do have a free introductory session. You can decide after attending that introductory session, which is going to be on 12th of August. After this call, we'll be sending a WhatsApp link. You have to join in that WhatsApp link so that you will get all the details about the 12th August program. So once you attend the 12th August, then you can decide. I'm sure that you will like it, and it is very, very important. We'll also send you this brochure, and also we'll give you a short video about what Dr. Sushil talked about this particular program on this.
So if you look at it differently, if you have any of these problems, there's only 20% chance that anything other than your lifestyle was responsible for it, be it your genes, be it your environment, be it an act of God, be it a bad joke of the fate, whatever you may want to call it, but 80% chance is that this is what caused it. Now, you can also look at it in another way. There's an 80% chance if you have been hit with this calamity, you brought it upon yourself. And that's really depressing. But as we go along, I'll have good news for you.
So this is Dr. Sushil is one of the facilitators. So please do log in myiwsp.com and you will get to see all the details what you wanted. So you have all the details. You can join the WhatsApp group and then you can learn 12th August session. Based on that, you can decide to join. So do not miss it. So with this, Subrata sir, do you have anything further to add? We are almost late by 4 minutes.
Yeah, nothing much, but I'd like to thank all the participants for joining in, and this is such an interactive and new kind of session. So hopefully all of you got more aware of it, and it's a new emerging area. Even doctors are not aware. We learn and we now see how to improve everybody's health and cure others. So thank you, Dr. Shruti, and thank you all the participants for joining in. It's a good numbers today.
Thank you so much.
Thank you.
Thank you.
Thank you so much. Thank you. Have a good night and good day for US participants. Thank you so much. Bye.